My name is Ajith Arvindakshan. This room brings my memories back. 2 years before, I was a patient occupying this bed. Right here in this room, fighting for my life desperately. I'm here to share my experiences as a patient in this hospital as they saved my life.
Hi everyone, as we are aware, this year we selected Brugada syndrome as the topic for nursing brand rounds. To support this, we took the case of Mr. Ajith Arvindakshan, who came to us with complaints of palpitations, VTAC and diagnosed as Brugada syndrome and later on underwent ICD implantation. So here is Mr. Ajith Arvindakshan with me today to share his personal experiences with us throughout his hospital stay. Welcome, Mr. Ajith. Thank you for coming today. Please take a seat. We really appreciate your presence today here with us. There is nothing more powerful and effective than feedback from a patient. Yes, of course, the experience and diagnosis of heart problems can be traumatic. Let us ask Mr. Ajith, can you describe your experience of feeling that your heart is beating so fast?
2 years back, when I returned from duty, I felt very sick. I remember falling down. My heart was beating very fast. I could feel it beating in my ears. I fell down on the floor. I'm unable to explain what exactly happened. After half a minute, I regained my consciousness. I called up my friends and they brought a car, took me to a private hospital. After I reached the private hospital, an ECG was taken at that time. I felt my heartbeat going up again and again. I felt I was going back to the same situation. By that time, they rang up the ambulance. I reached to the emergency. As I was transported in the ambulance, I was in a difficult state. Somehow I made it to Hamad emergency, where I was informed that I would be transported to a specialty hospital for treating cardiac patients. I could feel I was not my conscious self as they were moving me to the heart hospital.
Now, tell us Ajith, how you felt and what was your feelings or how was your experience after receiving the shock?
As I was lying on the bed, I recall I could hear alarms on the monitors. Nurses and doctors were rushing towards my room. At that time, I was feeling some discomfort and I could hear the conversation between the team members that I could be given shocks as it is an emergency. The team was giving me shocks. For the last 3 times alone, I could feel it and I recall that I felt like a ball being bounced up and down and I remember crying out loud. After that, I learned that I had received around 20 to 30 shocks.
As you know Ajith, we work as a team and our team consists of various sections of healthcare providers. That means nurses, you will find doctors, you will find pharmacists, physiotherapists. So let me ask you, what is your impression about the healthcare providers during and after the shock?
I was in a very anxious situation and I was really worried if I would be able to meet my family again or not. I had opted to come to Qatar to work and meet the needs of my family. The doctors and nurses were very supportive towards me. They attended to my every need and cared for me. I had so many thoughts running in my mind. My wife delivered just 1 month ago and I haven't even seen our newborn baby. I mean, I had only seen the photo. I was even doubting if I would be able to live or not. I realized that only because I reached the hospital and got the expert management at the right time, I'm alive now. All the nurses were compassionate towards me and backed me up. They comforted me with positive and kind words that I actually needed at the point of time.
So Ajith, we want to know what was your feeling when you heard that doctors came to you and said, this is the condition with your heart, this is what is happening with your heart and you have to go through a procedure where a small machine will be inserted inside your body and you have to live with the machine for the rest of your life and that machine is going to support your heart. What did you feel exactly that night?
The doctor told me that tomorrow I would have a surgery, so I had to abstain from taking any food or water and that I needed proper rest. But that night I was totally unable to sleep. My thoughts flaunted to my family. Would I be able to see them again? How will my life be again? After the operation, what's going to happen to me? Next morning, when they were about to take me to the theatre, I was so much in mental stress. How was the surgery going to be? Would I be given sedation? I didn't know how it was going to be. They got me into the lab and the doctors were talking to me in between the procedure. They made a small cut in my chest and placed the machine, but I did not feel any pain. The doctors made me aware in between that I could be experiencing a small pain when the stitches were made. They made me very comfortable. It was an overwhelming experience.
So, Ajith, you very well understood when the doctors explained to you about the machine, the complications, and in the future how you're going to live with it. So now we want to know, what was your feeling after the placement of this machine?
For almost 1 month after the surgery, I was very conscious about some device on my chest, especially when I tried to sleep. But after that, I got used to it. It did not bother me anymore. The team advised me not to lift anything heavy with my left hand. I continued to keep their advice. For 1 month, I took good rest and continued medical follow-up. After that, I traveled to India. For a few days, I felt weak, but now I'm happy. I have no problem. I feel I'm back to normal life.
Now, as you said, you have very well adjusted with this change. But we want to know, how did your family cope with this change? I mean, how did they react? What was their feelings?
I had informed my family about the surgery before. However, I didn't tell them or give them any clear details about it while I was in Qatar. Only after I reached India did I explain my wife the details about my health condition and surgery. I explained exactly what is my problem. I explained why the device was fitted and how to manage if there is any problem. My wife too conveyed her thanks and very grateful to all the doctors and nurses who attended to me while I was admitted in the hospital.
Yes, Ajay. So by now we understand that you have very well adjusted, and since these 2 years you're living with the device, you know how to take care of it. But and our team has very well explained to you the complications, how you're going to live with it, the do's and the don'ts. So let me just ask you, do you know enough how to take care of yourself? I mean, after the device implantation.
After device implantation, they had given me a few recommendations to follow up every 3 months at the hospital and also have an ECG and monitor my body weight. They did not recommend me any specific medications, and yes, they advised me against standing outside when there is a thunder or lightning, and to stay away from being scanned at the airport. They also provided me an exemption card to stay away from magnetic fields, not to carry heavy weight with my left hand, and to change the battery every 7 years, as that is the lifespan, and to use the mobile phone only with headsets. No other oral medications, but I was following all the instructions properly.
So now, Ajay, we will just talk about the lifestyle limitations that you have put on in your life after the implantation of the device. Like, what all changes you brought into your lifestyle that you were doing, and now you have to restrict them. So just share with us a few of them.
They also advised me to maintain my weight, not to put on weight, and to control my cholesterol, and to increase fruits to my intake. I'm following all the recommendations of the doctor. As of now, I have no problems and I am happy. I do not have a problem with my driving as I feared.
So Ajith, well, we have come to the end of the session. We just want to thank you for spending such taking out time from your busy schedule and coming here, and you took a very good decision to share your feelings, share your experiences. Thank you so much for that. Now, last but not the least, I would like to give you a chance. If you want to say anything in special, we would like to hear from you.
My huge thanks to the Heart Hospital and to all the doctors, nurses and other team members who treated me. I owe my life to this hospital. Now my daily activities are happening in a routine. I give my special thanks to the Qatar charity who supported me financially. Well, I am following up at the hospital every 3 months and they are very supportive for me. Every time I come to this hospital, I have a sense of belonging here like a family to me. I also thank the hospital for giving me this opportunity to share my personal experience as a patient here. I also take the opportunity to thank my superior, friends, and all of them who contributed in supporting me. Above all, I thank the Almighty God that I am still alive and I am back to normal.
അതിലുപരി ദൈവത്തിന് നന്ദി പറയുന്നു. താങ്ക്സ്.